Hey everybody, it's John Shinn back with another video for you today. We're still trying to break down what's going on with the coronavirus and how it affects people with Medicare. You'll see some of these articles or some of these videos that we come out with as we get news. It's a big topic today, a lot of questions. Seniors are at a high risk of serious illness, as we all know, from coronavirus. What we want to do here is talk to you about what's being done overall, what's being covered by Medicare. As you know, Medicare will cover all the lab tests for coronavirus, COVID-19, and all medically necessary hospitalizations, the same as it always does. As this also includes people who are diagnosed positive with COVID-19 and need to stay in the hospital, quarantine when they may otherwise have been discharged. If one becomes disabled, vaccines will be covered by Medicare Part D plans when these become available. You just check with your chosen plan, and those with Medicare Advantage plans will have access to these benefits. But some Medicare oversight plans, cost sharing will be waived for people who have COVID-19. Telehealth benefits. This is a subject we're covering quite extensively in these videos. These are big changes that are made. There have been alterations, modifications to how Medicare supplements, and Medicare Advantage plans will be covering. The good news is they're going to be covering all your co-pays, and anything really related to COVID-19 is going to be waived to make it more accessible. Cigna, for example, we work with Cigna HealthSpring. They're waiving their costs for that, for the co-pays and reimbursements. Humana, for example, previously announced it would be waiving consumer costs for COVID-19, so those are all about the same. Testing and anything that comes out that's not being treated now, including hospital inpatient visits. This applies to vaccines, should it become available, hopefully sooner rather than later. And there's no end in date for cost-free coverage. Mutual of Omaha, Medicare supplement, that's one that we keeping a close eye on here. Covering all things that are not being covered by Medicare on that. United Healthcare member cost sharing for the treatment of COVID-19 is waived through May 31st of 2020. For fully insured commercial, Medicare Advantage, and dual special needs plans, cost sharing for inpatient in-network visits are going to be waived for some Medicare Advantage plans through June the 18th of 2020. Blue Cross Blue Shield, we can report that they in the area. For more information, you just go to bluecrossbcbs.com for their further updates. But look at what enrollees can expect from Medicare, some problems to look out for, additional changes. All this can be done at bcbs.com. Does Medicare cover COVID-19 testing? Diagnostic tests will be covered under Medicare Part B if ordered by a healthcare provider that accepts Medicare. The standard Part B deductible is still in play. Most carriers have waived cost sharing and co-pays. Will Medicare cover inpatient hospital treatment? All outpatient services are covered under Medicare Part B, and rules covered by inpatient treatment needed. If you have a Medicare Advantage plan, just check with your chosen plan. You'll have access to these benefits and the benefits as well. So will Medicare cover COVID-19 vaccinations? There's no vaccination available yet, but should one become available soon, will be covered Medicare prescription drug plans Part D. These plans usually only apply to network providers, but this has a change due to the state of emergency. Usually enrollees will pay more out-of-pocket network, more with out-of-pocket, but the CMS announced that they will require out-of-network facilities that participate in Medicare to charge in-network rates. So that's good news. Prescription drug quantity limits, we're finding that there's provisions there that the CARES Act, both standalone drugs and Medicare Advantage plans will be included to provide supply of covered Part D drugs. To enrollers who request Part D plans usually have limits on that amount. Refill frequency for drugs covered under the Part B, Medicare and private contractors will make case-by-case decisions. So this is all big things that are in the news that are related to the COVID-19 and we'll keep you up to date as this goes. There's more to. There's plenty to read all over the internet, of course, all over television. But for those of you that have been requesting this, a lot of questions from us, we'll try to get you some sort of information on that. If this video was helpful, we appreciate you making any comment down below, or if you want to like the video, or you could call us here at Empower Brokerage. We'd be more than happy to try to answer your questions. So thank you for watching the video, and we'll see you on the next one.